Sorry, you all. And I'm still going to talk you all through it as you do it. The only bad thing is that 1, 2, 3, 4. We only got 5 students, so somebody will have to go last by themselves. I was going to try to get you all to do it all together. Huh? No, she's busy. Emails and phones. You would be the most likely candidate. Yeah, if you can tighten that one, I need it. I need to turn this one this way. There we go. Now if you tighten that one. Mhm. Oh, I think we're live. My bad. Hey, everybody. We're trying to figure it out. Good morning. Let me know if you can hear me. Okay, and then your volume's on your computer. Okay, we are good. All right, now I'll take it from there. Thank you so much. I got it from there. I can reach it. I appreciate you. All right, ladies, we need 1 person in the bed under the covers, 2 people in the bed under the cover. Remember, we have to switch out. So, oh, look, thank you so much. Alec is always good at getting in the bed first. Alec's like, okay, while y'all are slow. All right. All right, next person. All right, so we have our 2 patients. Let's get them nice and comfy. Miss Dolores, I'll have you perform the skill last. Or what I'll do is, okay, we don't have 6 people, so we can't do 3 beds. One student didn't show up. All right. So Miss Dolores, you're welcome to have a seat in the center.
Okay.
Miss Karen, we're going to start you off on this left side over here. And then we have you on the left side over here. The first is patient safety. Get your patient over towards you. So have your patient move towards you. Good. And now which direction? Every time at the test, but not during the class because it takes up too much time. So yep. So now go ahead and give them the turn. Help them turn if they need the assistance. At the test site, it's a human. They can do whatever you ask. Expose her backside. You have to see what's back there. At the test site, when you go to reach for gloves during your introduction, your nurse would have told you gloves are not required. In the real world, are you going to wear gloves when you're going beneath somebody?
Yes.
Yes. Be mindful your legs cannot touch the beds and the linen, so your legs need to be a little bit further back. What I'm doing right now is I'm taking the sheet from the bottom also, because usually at the bottom it's tucked, and that's called a mitered corner. What do you do to the bottom sheet? Think about the video. We're trying to change sheets, so what are we going to do to the bottom sheet? So it's rolling it in towards your patient. So roll, roll, roll. Imagine if it's some fecal matter or something in it. So you're trying to take it off and contain everything that's inside of it. Mm-hmm. Good. If the pillow had vomitus or something on it, would you still have the pillow under your resident's head?
No.
No, at the test site, you can leave the pillow, but in the real world, just consider their comfort, but also consider what's on it. And now you can't be too gingerly. You're going to let her know that you're going to touch her hip. So say, I'm going to touch your hip.
I'm going to touch it.
Are you right-handed or left-handed?
Right.
So with your left hand, touch her hip, lean her forward. With your right hand, push that under. Push, push, push. Get it under. You don't want to see it, because if you can see it, whatever's on it can get on your next sheet. Great job. Ask your resident if she's okay. All right. Now you can stand up straight over there. Oh my God, I was going to call you Lexi, and that would not be accurate. So now this is when you would actually check to see if there's anything on the mattress. And if there was something on the mattress, what would you do? Clean it. Make sure you dry it. Perfect. So now at the test site, before you got started, you would have had to get your sheets. You can't fan that one in the air. So you have to have wet 3 linens, everybody.
The bottom, top.
Perfect. So I have everything on the tables for you all. Notice also how I have the tables a little bit away, because you have to keep going around the bed. So you need it nearby, but not so it's blocking you. Do you mind taking off your shoes, getting in that bed under the covers? And then Miss Dolores, I know we're just a few steps behind, but I'll make sure you're good.
I'm sorry, can I ask a question?
Yes.
When you're in process of this, do you have to have the rail up for testing?
So at the test site, they may have rails on the beds, they may not.
Got it.
So if a rail is there, the direction you turn her, you have to have that rail up.
Got it.
But on the side that you're on, the rail will be down, so you're not working on it.
Right. But if they have rails, they'll
Come on over here, because your bed does have rails.
So I will leave that down.
I'm going to go ahead and raise it up, and go ahead and raise that one up, pull it out, and then take it towards the head of the bed to bring it up. So now you can decide if you want to work over a rail, or you can just lower the rail. Okay, so at the bottom, you push that button and then bring it back towards, and now push it under. Push it under with your hand.
What you mean?
So it tucks under the bed.
It does?
Yes, ma'am.
Wow.
So if you'll move her call bell,
Yes, I got it.
and now have her come towards you and turn away.
Are you comfortable? I'm just going to push you on your left, roll you onto your left side of the chair.
Great. And now expose from shoulder to foot. Get everything from beneath. All right. Now roll yours in. Good. And she can stay on her side. You don't have to hold her. She can stay on her side. Oh, I love her. She's not going to let her patient fall back at the test side.
You see.
But I want you to focus on rolling that sheet in, not holding her. She can support herself. Now, there are going to be some patients who can't support themselves, but this is not that case right now. Good job. Lift up her leg to get it under and keep going. Go, 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 go. You got this. Great job. Keep going, keep going, keep going. Your patient being extra and falling on her face, but you know your patient probably sleepy. The baby done kept her up all night. So it doesn't have to be such a tight roll. Lift it up and now push.
I see what you mean.
Yeah.
Just get it under.
Yep. And contain whatever's in it. Make sure that pillow isn't touching your uniform. Awesome. So everybody's at the same spot now. Yes, ma'am. Well, her asset is a little bit exposed, but you still have to see in the real world, this would have been a two-part skill. Hold up, Miss Deborah. Don't start late and go fast. You see what she's doing? Because I'm answering the question. This would have been done after the bath. So you would have them on their side. You would have cleaned their rectum. And then after the rectum, it's like, okay, while you're on your side, let me go ahead and change your linens. So sometimes they still have pee and poop on the bed and on the linens. So you can cover them up, but you need to see everything that's beneath them. So you'll figure out how much to cover them up. And in the real world, what's also closed? The curtain. And you have a right to see because you're there to clean her. So she's not overexposed. You just got to clean her backside. Okay, all right. This sheet you can.
It's like on the bed and then they made an accident.
And so once you clean it, and if you're really worried about it, put a towel on top of it. Yeah, but don't, because all this stuff has to come off. This is still dirty, so it can still have some poop on it.
Because I know.
But don't overthink it. Don't overthink it, because she's tired of being on her side. All right, so all right, so you cannot look how you're doing that. No, ma'am. Unfold it on the bed. Unfold it on the bed, because you cannot fan fold your sheets, because what would you be releasing in the air? Any kind of particles or linens, and you're going to find the end seam. All right, and so it's going to be find the two short ends. So that's the long end. You're right. This is let me make sure that's a short end. Short end.
I put my sheet on by the tag.
Okay. All right. So let's try this one right here first. Lift and tuck. Great job, ladies. Let's see what you're doing over here. Good. Lift that mattress and now roll this one towards you. Because if you just push it in now, it's going to get those contaminants from the dirty sheet. Good job. Let me help her over here. Mr. Loris, I'll be to you next. Keep going, keep going, keep going, keep going, keep going. Lift the mattress. And now tuck everything on the side also. You got to tuck it along the sides. Lift the mattress, lift the mattress, lift the mattress, lift the mattress. All right. Okay, all right, roll. And they can touch, but they shouldn't necessarily overlap, okay? All right, go under her pillow also. Under her pillow too. All right, you're going to have to lift her a little bit more. She's blessed back there. There we go. And push, and push, and push. All right. Miss Dolores, let's get you to raise this sheet and tuck. But she like, you ain't lie, you ain't lie. I'm gonna get this right here rolled a little bit more, okay? So it's like sometimes these patients are gonna have a big lump under them because it could be pads, it could be a lot of stuff. Lift that pillow. All right. Ask your resident to lie back on their back, but do not let that top sheet go beneath them. Okay, and that's all you're doing. Do not pull that sheet back out because remember the goal of that sheet is to come off. Look at her with her rail. You're protected, but that sheet also touched you. So while you're being extra at the test site, don't be that extra.
Just leave the rail down.
Or drop the sheet first. You try and do 3 things at once.
Bam.
And your nurse is watching out. Stop, stop, stop. Look at you tearing your patient's skin. Would you please walk around this way?
Yes.
You're tearing her skin because you're pulling the sheet from beneath her. Would you walk around this way? So now safety again. Have them come towards you. Listen to your nurse over there, your CNA. Okay, and then she would turn away from you. Just make sure she's not close to the edge. And if you were concerned because you had a confused patient, what would you have up on the side they were turning to? The rail. At the test site, you're not passed or failed on the rails. You're passed or failed on how safely you can turn somebody. Because in your ALFs and some of your nursing homes, the beds don't have rails. Do not expect that you're in the hospital setting for your test. All right, so once she gets on her side, we're good. You can give them to their side now. And now cover up her assets, cover up that backside. And I'm not going to move the sheet, but I know she's wrapped around. So you want to demummify. You need to see, again, you need to see what's behind her. And your goal is to get prepared to take this off. All right. Don't uncover her so much. Now move that part right there. All right, so make sure everybody's in the same spot. Pause. You're not wrong. You're just trying to move fast. This way, everybody to the foot of your bed now. Roll up your dirty sheet. Roll it not towards you. Roll it up and away. Up, up, up and away. Contain it, contain it. Go, 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 go. Try not to pull their skin. If you have to lift their body, you lift their body. Don't let it touch you. Good. I'm watching everybody. Don't let it touch you. Thank you for pausing, Miss Karen. I saw you. I know you want to go. Don't let it touch you. Great. Pull that bottom sheet and pull it hard and tuck it. Pull hard and tuck it. Check on your residents, see if they're okay. What if she would have said no? How would you have responded?
I would ask, what is the, like what?
You'll be back on your back soon because you have to get your job done. Try to pull it down more to tuck under the mattress because I saw that wrinkle. That means your nurse can see that wrinkle too. So your sheet, you're good. Your sheet's just stretched out. Sorry, you're at Nurse Eunice's nursing home, and we gave you a stretched out sheet.
I'm trying to.
So sometimes that's going to happen. Pull tight, lift up that mattress and tuck.
Okay.
Pull tight, lift up that mattress and tuck. Because we ain't buying any new sheets this week. And once I check your bed and say you don't have any wrinkles, you can lay your resident flat. But don't have them lay on that top sheet. No wrinkles, you can lay your resident flat. No wrinkles, you can lay your resident flat. Great job. So I want to show you all this. She has wrinkles on the side, but that's not her fault. Her sheet was stretched out. There shouldn't be any wrinkles under the resident. So great job. You can lay your resident flat. All right. Go ahead and fold the foot of that sheet up. I'm going to bring the foot of the sheet up. Bring it up towards her knee.
Can I ask you a question?
Yes, ma'am.
Once we do this, once we roll the sheet up, just have the feet exposed.
So you're taking it up to the knee.
Okay.
Because now you have this whole working area
Got it.
for your new top sheet. So you just changed your fitted sheet, and now you're going to change your top sheet. So this provides warmth and it provides protection.
Okay.
So she said she chilly, Lord. There's your top sheet. There's your top sheet. And there is your top sheet. All right. Don't let it touch you. Same way you did last time. Figure out the orientation while it is still on the bed. You all are the quietest bed makers ever. Say something to your resident. Look at you shaking that sheet. And you just shaking it, shaking it, shaking it. You don't get that many shakes, you all. All right. At the test side, you shake. So what you're doing is instead of working on that side, come down here and work down here.
Okay.
And then that way, and then very good job, everybody. Once you have allocated some of the material at the foot, one hand is going to find the top seam. One hand's going to hold this, and the other hand's going to remove the dirty. Up, up, you're forming a tent. You're good. All right, so here, hold this here. This hand here, don't put anything in her face. So this forms a tent. Bring it up. Once you get it towards her genitals, come on, come on, come on, come on. Drop. Thank you. Come on. Don't. What the ham and cheese? What you doing over there? What the dirty stuff is now on the clean sheets. We gotta do that over again. Correction.
Correction.
The goal is to get this dirty one off of her without you touch the bed. What do you need to say?
Correction.
Roll it all in together. And now lower this. 2 hands on this. Take it away. I'm coming, dear. You got to make a tent with this one so no one can see. So make a tent. Okay. Lift this one up. Lower this one. 2 hands. Take that one away. Great job. You all can pull that top sheet up and then fold it back. We'll do the mitered corners last. It touched you twice, Miss Karen. What do you need to say?
Correct.
Correction. Make sure nothing's touching your uniform.
Okay.
So you see how with the rail, it's a lot going on. It's hard being a patient, right? This is a very humbling experience. It makes you realize, like, no, health is wealth. All right. So now remember to tuck the bottom of the top sheet. You have to tuck it under the bed. Just the bottom of the top sheet. Right here. Tuck the foot.
Okay.
So you're going to tuck it under the mattress first. Don't let it touch you. Literally lift the mattress and tuck it. Really? Lift the mattress. You ain't got to lift, what if they're 500 pounds? You ain't got to lift both. You ain't got to lift the whole mattress, Miss Karen. You can do one side at a time. All right. And so then you're going to go to the side of your bed. And the first layer of your sheet you bring up at an angle. You tuck the remainder. So it's up, tuck, down. Very good. Good. Up, tuck this. And now lower it back down. You have your V. That's your mitered corner. Go to the other side and do the same. Up, one layer. Good job, Mr. Lars. Tuck. And then back down. Yep. Pinch and ask them to wiggle their toes. First of all, she's fully asleep. She's very comfortable. All right. So during your test, you have 3 linens to change. What's the last linen? The pillowcase. Ask them to raise their head. Put the pillowcase down. Ask them to raise their head. All right. Good. And then you can pull off the pillowcase. And then I'm just going to have you, for classroom purposes, put the pillow at the foot of the bed. At the test site, you can put it on the table. Put the pillowcase at the foot of the bed. I'm sorry, the pillow at the foot of the bed. I'm trying to keep everything clean and organized. I see you putting your arm in that pillowcase, Mister. All right, good. All right, so we're gonna, tag goes in first. Why does the tag go in first? So seam to seam, but the tag, perfect, but the tag end of the pillow goes in first. Beautiful, beautiful. And then once you get it in, you can stand it up. I would recommend you go all the way. When I say seam to seam, you want to see the internal seam on that pillow case. Where's your seam at? Right here. So good, seam to seam. And then You can stand up and pull it down. You can hold in the center and pull it down, but you can't shake it. Now, y'all so fast. I'm trying to take care of the linens over here. Good job. And you made your envelope. I see you over there. Don't you shake that pillow, Miss Karen. Just lower it down. Don't shake it. And now make your envelope. What's the purpose of the envelope? So just pretty much it just looks neater. That's it. So if you don't do the envelope during your test, it's not going to fail you. Christian is asleep. Christian ain't gonna remember the skill. Very good. All right, so everybody go ahead and do your HCCD. Well, you're next to her, so don't wash your hands yet. What can you give her? Call bell. And what question? Pause down. You give her the call bell. What question do you ask? Why is your resident acting like she don't understand the language? All right, so and at the test site, your nurse would have said gloves are not required for this skill, but in the real world, yes, you'd be taking off your gloves. And then what happens after that? Wash your hands and then document. And for the test site, we don't let you raise the bed. When I say us, I mean Fuller Training Academy. Because if you raise that bed to a working height, you might forget to lower it. But in the real world, if you raise that bed up to a working height, make sure you do what? Lower it back down. Mhm. Put it back down. And this may not even be your skill during your test. Yep. But I'm also preparing you for home care. In home care, they may not have medical beds. Your test is not geared to our hospital. All right, you all can switch places. Who's ever phone if you'll take care of your alarm. Oh, wake up, girl. Wake up, Alec. Great job, team. Give me a few moments to get y'all some new linens. I'm trying to get everything together now.
Amen.
All right, so we got top sheet, we got bottom sheet. Let me get three more pillowcases and 2 bottom sheets. All right, let's switch. This is a long skill. Let's switch. And at the test site, the head of the bed, when you start, the head of the bed might be up. So remember that anytime you're turning someone, repositioning them, how should the head of the bed be? The only exception is if your patient cannot tolerate being laid flat because maybe they're short of breath or something. Huh? I know it doesn't feel good, right? Very humbling. Thank you, Christian, for covering up your resident. She looks. All right, so good job. All right, ladies, start on your right. And we're only doing this for classroom purposes so that you all are not bumping each other. So HCC is already done. You can start with positioning your resident safely. Great job, team. Great job. All right, roll that dirty bottom sheet in. And don't forget to check on your resident. Make sure nothing's touching you, Christian, because I'm not over there and you have a habit of letting things touch you. And then you can put one hand on them to lean them forward. Do some muscles, baby. Let's push this. She don't want to be on her side all day. Push. Push. Come on, push. Get it under there. Push. Get it under there. All right, so once you have that, everybody, you can go ahead and get your clean bottom sheet. Remember, you can't like just, it's this stretchy one. You can't aerate it. You can't do it. You can't do what you're doing right now, Christian. Put it over the bed. That way it won't drop on the floor. Talk to your resident. Are you okay? Find it without shaking it. You okay over there, Alec? Okay. You got it? All right. Good job, Miss Nicole. I see you moving, moving, moving. Nicole is like, I want me a lunch break today. Come on. Lift that mattress up and then work your way all the way to the top, Nicole. Work your way to the top because now you switched your ends. Looks like this is the end that you want, the one that's down here. So work your way up and find that end. What end, right? I don't know, girl.
Yeah, I think so, because that one's short.
So it's this end right there. How many beds? No one taught you that. No one taught you to push that mess under that person like that, ma'am. You did not learn that here. Lift this mattress. Lift this mattress and tuck. That's going to help you get out some of those wrinkles. And then, yep, you roll it in. And now you can lift up her hips a little bit and get it under. How are we doing over here? Good job. Roll it in. That'll get those wrinkles out. And now push, push, push. Good. She's safe to come on her back. Once I see you don't have any wrinkles, she'll be safe. All right, so now we're going to roll this in. Roll, roll, roll. I'm not going to do it for you. Roll it in. And then push. Push, not with your hands up. Push with your hands down. Push it under. Go, go, go. Push it under. Get it under her. Otherwise, I'm going to get in the bed and I'm a lot heavier. Okay? All right, you cannot avoid touching her. Say, I'm going to touch your hip.
I'm going to touch your hip.
Lean it forward, push it under. You're going with hands up again. Hands down. When you go with hands up, it's like you're touching her butt. Okay? So it's always hands down. All right. Hold up, now. You're moving so fast. Slow down. Wait for your partner to move. Y'all ain't playing. I need to see what you're doing. You can't see what you're doing. And there's pee and poop beneath you, or beneath her, excuse me. And then you want to start at the foot and then work your way up. Good job. No wrinkles. You can lay her on her back. And just wait for her to step out for you. Okay. Good. Work around. Have her move towards you. And now you can go ahead there. Good. Some more, because when you turn her, she can't be close to that edge. So she needs to be in the center of the bed. So talk to her some more. Talk to her some more. Come over a little bit more. Because when you're turned, you need to be in the center. Okay, now tell her what to do. Great job. Come to the base of the bed. Roll that up and away. Oh, you all are making this bed in no time. Pull tight and tuck. Pull tight and tuck. Lift the mattress. Lift the mattress. Pull tight and tuck. Ooh. Good. Thank you. All right. Pull that bottom sheet towards you. Pull it tight. Pull it. Pull it. And then when you tuck it, you have to lift that mattress. No wrinkles. Your resident can lay on her back. No wrinkles. Your resident can lay on her back. Don't let it touch your leg, Christian. Christian, all for 4 days, I've been saying stop letting stuff touch your leg. At this point, your nurse is not going to let you say correction any longer because it's just, you like to contaminate your clothing. I don't know why. Ladies, you all can continue. And then she doesn't have any more wrinkles, so you can have her lay back. Okay. Go ahead and take her top sheet up to her knees. And be careful with fanning that. I know it's going to be hard and cold, but try to unfold it on the bed. And this will be a good time during in the real world for you to ask them about maybe their eating habits, their activity. Are you eating, lunch okay? What we like bingo. Bingo is a good conversation. Some of them like puzzles. Maybe you can look in their room to see. So be careful with this because it's touching. So one hand here up to make that tent. This one, it's like without touching, you're bringing it over and in and up, lower. Take care of that one. You're good over here, dear? Okay. So it's gonna be without touching the bed, up and now. So you grab the whole thing if you can, lower this one, take that one, laundry basket, which I have way over there in the corner. Sorry. Why is your patient over there fighting for her life with her arms up? What's going on, Mr. Loris?
I was practicing doing a certain
All right,
kind of
let me have your left hand. Your left hand's going to form a tent. Your right hand's going to start gathering all of this, like folded on top of itself. Bring that side in and over. The side nearest your pick all this up now. Don't let it touch you or her. Sorry. Laundry basket. All right. Before you tuck yours, I see you trying to even it out. I'll help you. We're even on this side. Looks like she has way more on this side. So you may want to pull it down some on this side. Okay, good. And hopefully your sheets at your facility are not this long. Okay, we're good on this side. Okay. Y'all be careful. Nicole, so same thing you did. Looks like you have more material on that side than you do on this side. You're gonna come and pull it. Nicole ain't gonna let you. Nicole not gonna let you work. Y'all gonna be over there bumping each other. Okay, so let's pull this down. Gotta pull it down some. Okay, now Nicole, let me look at your miter corner. Let me see this one. All right, so I'm gonna help you with your miter corners. Okay, so if I can get you to stand right there. This first layer goes up at an angle. So bring that first layer up at an angle. Just one layer up at an angle. Now straighten that out, tuck that under the mattress. Now, when you bring it back down, you're going to have your V, your mitered corner. Okay, now if you'll repeat that process on the other side, right, because we have a large, so this one right here, you're perfect, but you're going to go up and over. Okay. And then, yep. Mitered corners are not required on your test. Going to break it down just a little bit. Okay, tuck this. The bottom sheet gets tucked at the foot of the bed. Top sheet, excuse me, gets tucked at the foot of the bed. You cannot tuck the entire sheet along the sides. That will become a restraint. You lift up the mattress. I didn't see you lift up a mattress. Has to be tucked under the mattress. It doesn't. Did you tuck it under the mattress? I ain't doing that for you. Tuck it under the mattress on both sides. You can proceed to your sheet. Your pillowcase. I'm sorry, I looked at her and she was sleeping. It kind of. Okay, so it's going to be, you'll stand right here for me. This top layer you bring up at an angle. So just one layer, bring it up at an angle, up, tuck the remaining part under the mattress, smooth it out, put the whole thing under there. So that piece right there. And now when you bring it down, you should have you a V. Good. And now if you repeat that process on the opposite side. Are y'all hot yet? I'm sweating for y'all. Your patient said, no, she's not hot. Now, ma'am, Christian, you just failed your test. I just told you not, you only tuck the foot of the sheet. You just put her in a restraint. Pull all that stuff that I didn't tell you to tuck under there out. All of it. All of it. All of it. And now do what I taught you to do. Don't add anything to this. That's it. Nope. That's it. Yes. No, but you just tuck more. Take that out. That's it. That's it. Lord, this lady over here. If you tuck the top sheet along the sides, you make a restraint. What do you need to restrain a patient? A doctor's order. All right. All right. And so I just want your bed to look a little more perfect, Alex. So when you look at it on this side, you see it's like more diagonal. So you just go on the other side and pull it over a little so that if it's even on this side, so let's bring it down, son. So if it's even on this side, it should be even on the other side. It's okay. Well, Alec, your bed is just not go. It's not well.
Is hers?
I'm sorry.
Alec, these it's the sheets, Alec. The sheets at Nurse Eunice's nursing home. All right, everybody, go to the head of your patient. Go to the head. All right, 1, 2, and 3, because this is going on. All right, y'all can go ahead and get up. You've been discharged. Oh, they did their pillows.
I told her, I said you would give her instructions.
Oh, so I'm sorry. Y'all are done. We have one more who needs to finish. No, I'm happy you said something.
I didn't know.
You remember how to do it? But you can't put the dirty pillowcase on top of her sheet. So, but it's still touching. So just pull it off just pull it off. Thank you all for changing our linens. We appreciate you all so much. And so at the test site, you can put the pillowcase on the bedside table because your laundry basket won't be on top of the bedside table. All right, so there we go. And then, yeah. And then, Miss Dolores, you don't have to stay in the bed while she's changing the pillowcase there. This is a good time for y'all to take a break. All right, so let's help you. Pause, because you're about to shake it and you can't shake it. The tag end goes in first. Open up your pillowcase until you can see the seam. Scrunch it down, scrunch it, scrunch it, scrunch it all the way down, all the way down. You're not folding it, you're just scrunching it. Just scrunch it. And you want to see the internal seam. Too close to your uniform. Your arms got to be extended because you touch your shirt twice. So now you're going to invert it, seam to seam, seam to seam. Hold it in the center. Pull that pillowcase down. Don't shake it. But now you're going to have to shake it. Pull this extra material in. Pull it down. So it's a little bit easier to do that while we're still standing up. Good. Tuck. So what you want to do is you want to make like an envelope. And the way you make an envelope, sorry, I just shook it. Correction is you. So that way none of the pillow is exposed. Not a requirement. It just makes your pillow look better. Great job. It's okay to struggle with a pillowcase because when you get home with your own pillows, you get the practice. Don't let that pillow touch you. All right, go ahead and put it under your patient's head. Would you please raise your head up? Great job. Now you're done too. It's fine. I'll make the bed. You're good. All right, everybody. We need a few minutes to set up for our next skill. All right. Hope you all are having a fantastic day. So you want to go ahead and read, practice the skill for changing the occupied bed, and then you can take your break. If you want to read, Nicole, thank you. She'll take one for the team. I'm going to start setting the beds up.
Practice the skill. Did you? Lower head of the bed before changing the sheets. Keep a resident position at a safe distance from the edge of the bed at all times. Loosen tuck dirty bottom sheet on working side and push or roll and tuck against resident. Complete placement of bottom sheet Securing flat sheets at the head of the bed and on the sides, using fitted sheets secure all four corners. Leave the bottom sheet free of wrinkles. Place a clean top sheet. Avoid exposure to the resident throughout the procedure. Secure the top sheet under the foot of the mattress, allowing room for foot. Leave the top sheet untucked on the side. Replace pillowcase. Dispose of soiled linen in a hamper. Complete the procedure with the resident positioned between the top and bottom sheet and cover each pillow under the resident's.
Y'all don't have to turn around. Do y'all have any questions? All right, next skill. If you all will go to page 5, our accountability page. And then Deja, I'll have you tell me the skills that we have not covered. All right, page 5. Deja, what skills do we still have to cover?
The partial bed
Okay, partial bed bath. What's next? Dressing the resident with a weak arm. Perfect.
Well, how to empty a urinary drainage bag. The catheter care.
Perineal care, excuse me. All right. So everybody agrees? That's all we have left? But an output. So with the draining of the urinary drainage bag, I'll show you how to use the container and document your output. All right, y'all don't need a break, you're good. Finish making your coffee. Ladies, I need your help. I need 3 ladies with this mannequin, or 2 ladies with this mannequin. She'll go in the far bed. So she'll go in the far bed, and then I'll need 4 ladies with this mannequin. This one takes 4 people, you all. I don't want you all to hurt yourselves. All right, can you move? Move a table. All right, can I get someone to move the end of the bed? Because this gurney is an old-fashioned word for a stretcher. This gurney doesn't move well. All right, so if we could lower this, we would. But you want the bed that you're transferring her to be lower than the bed she's coming from, so to be smooth. And we're going to take her with all her sheets. So whenever somebody comes to you from the ER, for now, I'm just going to put that over there. I hit the other patient. You're right. All right, ladies, take off this sheet. Pull your patient over. And we can pick her up. She's really easy. Watch out for her hand. So get her hand in there too. So somebody need to be like up here. But you're trying to get the sheet. So you all lift that sheet up so she can get to it. Great job. Okay. And you don't put it on the side rail. You put it on the frame that the mattress is on the side over there with you. Whoa! Ow! Ow! Y'all just threw that lady in the bed like that. Poor lady. All right. So now you're going to do a team turn so that you all can get those sheets from under her. So team turn would be you two without your legs touching the bed. Reach over. Reach over. You all go under. 1, 2, 3. Now you all stop holding her. Push all that dirty stuff under. Make sure her gown, because I told you about wrinkles in the gown. Keep that gown open. All right. And now repeat the process. So you all go under and they go over. All right. Make sure her face doesn't hit the rail. Take off the dirty without anything. And I don't want that sheet on. I don't want her gown under her. So like this part of the gown would go up and open, and that part would be pushed under. Yes, she has wires. A lot of wires. Because she actually breathes. So like this gown, you don't want those wires, those the wrinkles under her. So push the gown under.
I'm just trying to make in real life. We'll make sure all her little stuff. So,
but this right here needs to go under. Otherwise, she'd be laying on a wrinkle.
Got it. Okay.
All the way under. Push, 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 push. Because they tired of holding. Look, they're struggling over there. All right. Great job. Thank you all for helping set up the room for the mannequins. Why is she so far down? Thank you, and cover her up. If she says yes, we running. But she has, what does she have in her neck, everybody? So patients with a trach shouldn't be laid down for long. So you're just laying them down long enough for them to the linens to be changed, and then you sit her head of the bed back up to about 30 degrees. So it looks like her find the little squiggly line, the squiggly cord. Yep, and raise her head of the bed. Oh, look at y'all. And give her call bill. All right, great job, ladies. Look, I love how she's holding her back already, and we just got started. All right, so you all are welcome to have a seat. We're going to start off with let me figure out which. Thank you all for transferring the residents into their beds. So what did you learn about working as a team? You have to communicate. You have to, because if one's pulling while the other one's turning, the patient knows we're not organized, and they're gonna talk about you. Someone's back is gonna go out. And when you're transferring a patient from a stretcher to a bed, what goes higher? The stretcher, because otherwise you're trying to take them uphill and you want to take them down. I see y'all waiting for me. I'm trying, y'all. I'm trying. All right. I think the easiest skill for us to do would be to dress a resident with a weak arm. So if you'll find that in your notes. And in your stapled notes, what page is it on? The quick notes. 12 and 62. That coffee smells so good. Too bad I'm already sweating and I ain't trying to. I know. Oh, there we go. The air finally kicked on. Thank you, air. You knew. All right. So, what supplies do you need to dress a resident with a weak arm? All right. So, socks, pants, and two choices of shirts. No underwear. They're not requiring you to put a resident in their underwear for your test. A lot of your residents don't wear underwear anyway. Have a full class. Yes, yes, yes. All right, you all. Let's get you to the bedside. Would one person bring their staple notes so we can just the page 12 of the staple notes so we can look over them? You're welcome to have a seat, sir. Let me see if I can do it from my phone. Who do I need to block? Courtney, you are getting blocked. I'm not sure what you're saying. As soon as I could find you. I'm not able to find Courtney, so you'll have to come over here and find her in the phone. All right, everybody, we're getting ready for our next skill now. All right, come on through. All right, the easiest thing for you all to change first would be to put on some socks. So I know what the notes say. The notes say to dress the resident with a weak arm, we're going to undress the gown from the strong left arm first, or so from the strong. It's always been from the strong side first. You will remove the jacket from the weak. It'll make sense in a moment. Do not leave wrinkles and fasten all snaps. Place the socks, pants, and jacket. Say correction for overextending the extremity. Place the jacket on the side. The skills card says it's the weak side. For the last decade, the weak side has been the right side, and the strong side has been the left side. Start moving the gown from the opposite side first. So here we go. I'm gonna have one person on this side, one person on the opposite side. At the test site, you will not be working as a team. It'll just be one individual person. So who wants to put on socks? Easiest part. You two ladies, go ahead and expose her feet. And you can talk to her. Hey, I'm exposing your feet. How awkward, right? All right, so gather the socks like hosiery. Because remember, they could have that G word on their toe. What's that? Gout. And so we don't want to be, let me get you to stand up just a little bit. We don't want to be pressing on their toes. Socks on, and then smooth it out. Next, the easiest thing for you to do would be the pants leg. So whenever I am providing this care to a resident, when I'm dressing them, normally you'd be dressing them when it's time for discharge. Otherwise, they're in the hospital setting, they're going to be in their hospital gown. Residents in the facility, they put on clothes every day. So I don't want you tiring yourself out trying to turn somebody who's bedbound. Do socks and pants first and then work your way up. Residents in the facility sometimes wear pants twice. So don't do this. Because if you do this, what's getting on your arm? Whatever, exactly. So at the test site, gloves are not required for this skill. In the real world, you're going to wear gloves. Okay, so I'm going to ask that you gather her pants legs like hosiery. You can only do for this one. You're going to do one side at a time. Okay. So whoever wants to go first, gather the pants legs up like hosiery. Pull it up without sticking your arm all the way in it.
You remember pantyhose?
What y'all call them new fancy things y'all wear that like they look like skin, the flesh tone things? See, you gotta So they got like flesh tone types or something.
Yes.
I mean, those are kind of flesh tone as well, but they're like.
And so you can like stick your hand through right there, just your hand, not your whole. And so now you can guide, lift up her foot without touching her toe, lift up her whole foot. Good. And now, Nicole, you can do so on your side. So you just slide your see, we'll get a run if you do it like that. You'll get a run.
You gotta like bunch it up.
All right. So now correction, because we cannot lift her legs and her butt with her sitting up. So what do we have to do? Lay her flat. So this would not have failed you. It's like, okay, now I need to lift her. I can't do it if she's upright. Okay. I got them from the Dollar Tree. Nurse Eunice doesn't spend much money. All right. So now what you can do is you can actually raise her because she still has a gown. So you can raise her sheet up. But instead of you raising her gown up, you're going to allow the pants to push the gown up. It that way. Uh-huh. She's only like 100 pounds. You can lift her bottom up. Mm-hmm. At the test site, they usually have heavy mannequins that may be about 70 pounds. Make sure it's up on her bottom. Because you're getting ready to do a lot of work. So the CNA exam is a little bit of work in preparation for a lot of work. They're going to pay you that money and they're going to expect you to work. Tuck it under the foot of the mattress, and you all know how to do your mitered corner. So tuck it first. You got to tuck your in first, Alec. Tuck. And then you can do your up, tuck down. One layer. You're doing 2 layers. One layer up. I got you. Oh, Alec done got tired now. You almost got it. So let's lower everything. Just one layer. One layer at an angle. One layer at an angle up, and now you tuck everything. All right, wiggle her toes. Make sure she has enough room. All right, so we've done the socks and the pants. If you get this skill, how many minutes are you most likely to get on your test? This is a long skill, right? You're going to get closer to 40 minutes if you get this skill. So your timing is based upon the skills that you get. So if you got like pulse, feeding, and mouth care, that's closer to 31 minutes. You start dealing with mannequin skills or changing the bed, you're going to get 40 minutes. All right, so go ahead and pull your sheet from her shoulders. Pull it down. All right, and so she has a weak right arm. My recommendation is that you put the jacket on the side that the card says is the weak side. So this is, of course, after your introduction. And you just put it on the side on her pillow. All right, and then you start undressing on the strong side first. So you may have to lift her shirt, her head, excuse me, so you can untie her gown. So when you lift, and then this hand over here, you got 2 hands, and lift, and then lift, sit her up, hold her up. Which hand is stronger for you? Okay, and so there you go. Don't choke her. And now you can lower her down. You could, but then you have to lower it right back down.
Oh, God.
Because now you have to undress her. So to be lifting her up to do that. Now, if this person was 500 pounds, complete dead weight, use the bed. But she's lightweight and she's pretty limber. So now this gown has snap sleeves. When you take your test, I don't know what type of gown they're going to have. The benefit of snap sleeves, if somebody has an IV or something that's infusing, we don't have to disconnect their IV. We just unsnap the gown. So we're going to pretend that this gown does not have snap sleeves. You're going to raise this arm, support it, bring it all the way up without exposing the chest. Great job. And then you have to gently lower the arm. Beautiful. This would be her at the test site walking to the other side. All right, so because this was a strong arm. This is the one. So this is stupid, for lack of a better word. It's a mannequin, so neither arm is strong. It's a whole mannequin. So test site, you're pretending like the mannequin can move. Your nurse will be on one side of the bed, you'll be on the other side of the bed. So Nicole, if you can take off, you're going to support your arm, and you're going to remove the sleeve of your gown next. At some point, y'all can talk to your resident.
I was just gonna say.
I was just going to say. All right, good job. And now, Nicole, on the side that you're on, you're going to get the sleeve of your jacket. And again, you're going to bring that sleeve in like it's hosiery. Good job. And I'm going to ask that you put your hand through this end. Probably your left hand.
Yeah.
Right hand. I'm
Okay.
sorry, I said the wrong one. And now use your left hand to lift her arm. And now you're going to guide that on top. Okay. Great job. Lift this arm up as you're bringing the rest of it up. Allocate this top part. All right. And then I'm going to pause you because now you're officially the nurse. At the test site, the nurse will only help if the CNA asks for help. So, nurse, I want you, CNA, I want you to ask your nurse, would you help me turn?
Nurse, would you help me turn?
Okay. And so the technique we talked to, you're going to go over. You're going to go over. You're supporting this arm. You're going to go under on the count of 3. 1, 2, 3. Turn your resident. You stand up straight with straight arms. Now, what you're going to do on this side, Nicole, is you're moving this arm over. Lift this jacket up. Lift it up. Lift it up. Push that gown forward. Good. Now bring the jacket back. And you don't have to hold Nicole. You got to trust her. Push this gown through. Push the jacket through, excuse me. Making sure there's no wet in the jacket. Wrinkles. Great job. Now, Nicole, you have receiving hands. It's like you're trying to catch a ball. There you go. Bring her back. Ask your resident a question. The nurse not supposed to be asking a question. Great job. Now you two will switch sides. And if you felt like she was exposed, which she isn't because she's fully clothed, you could raise this up some. All right, so now it's the opposite. Now you have to get on her side again. So you don't have to do that move to the left, move to the right if you have a partner on the other side, okay?
Nurse, are you able to?
And you have to make sure you support those arms. 1, 2, 3. Nicole, you push. And then nurse, you stand up straight back, straight arms. All right. And so awesome. You're going to gather the sleeve again. And you may have to pull it down a little bit. So this is the hard part. I'll tell you what I mean by pull it down a little bit. Is right now it's on her shoulder. So if you can't see over there, Dolores, it's on this shoulder. And so because they may have a stiff mannequin, this arm won't have enough range. And if you start doing too much to the arm, that would be uncomfortable. So what I'm going to ask you to do instead is just to take that off the shoulder just a little bit. So you would be able to bring this down more. Go ahead and do what we taught you last time. Feed your hand through. While she's on her side still, your nurse is still holding. The nurse just isn't holding the arm. You're responsible for the arm. Check on your nurse would answer for her. Okay. Oh, that arm looks flipped, doesn't it, Nicole? So there we go. And now bring this material forward. Everything comes forward. Get the wrinkles from beneath. And then you can lay her flat. You have receiving hands, Nicole. You're catching. Don't let that arm flop. So again, if you get this skill, how many minutes you're going to get? All right, so now you all can work as a team. You can get her centered in the bed, shoulders. Don't go under like that. Oh, let me show you this. So you would 2 shoulders, 2 hands, 2 shoulders, move her towards the center, lifting up. Okay, good. Her hips the same way. 2 hands, 2 shoulders, get her centered. I know we still have a gown, so you're good. She's kind of centered. But if her hips were kind of slanted, you would do on top, move over. Okay, and so you can now fasten the buttons on the jacket and then remove the gown that's beneath. Make sure she's nice, neat, and in alignment. Fasten first so that you don't overexpose her. How did they do, team?
Good.
Good. Woo! Guess what? Your patient just used the bathroom in her clothes. They'll do it too. Yes. So you probably take them to the bathroom before you get them dressed. All right. And so when you remove the gown, make sure it doesn't touch you. So you're gonna go under.
Are you fine? We're not hurting you.
No, you're not hurting me. You're just slowing me down from going to bingo. And for classroom purposes, you can put it over there on that table. That's going to be the laundry basket. And then Nicole, if you'll straighten out her arms and her legs. So everything should be in alignment, not one hand up, one hand down. So it looks like her right hand is up, her left hand is down. Keep her in alignment. And then these pants are too big for her. But if you can just straighten the wrinkles out, even if you have to make a cuff at the bottom. And again, for you all being such wonderful students, once we edit your videos, you all will get your private video link. Yeah. Yeah, you're superstars. All right. All right, cover it back up. And you all have dressed the resident who was pretty much total care. Yes, you had a question, dear Christian? Oh, you're clapping? All right. Good job. So what I'm doing is, you shouldn't do this. Don't sit on your patient's beds. All right. All right, let's go ahead and read, everybody. All right, so we'll read practice a skill in your books.
Practice the skill, did you? Include the resident in decision making about clothing to wear. Select all garments before removing the hospital gown. Support affected the right arm while undressing and dressing. Remove the hospital gown from protecting the affected arm. Dress the affected/weak right arm first. Gather up sleeves to ease fully over the affected arm. Assist the resident to put on pants, a shirt with sleeves and socks. Move the resident's extremities gently without overextension or force when undressing and dressing. Address all clothing from comfort, neatness, and alignment. And close all fasteners. Place the dirty gown in the hamper.
Great job. Any questions there? I don't want to show you this extremely long video on how to give a patient a bed bath. So what I'm going to do is what I did last time. I'm going to show that video in like really fast, but this time I'm going to not have the volume on because that was distracting because I'll sound like a chipmunk. So, but that gives me time to set up for the skill. So partial bed bath is on page 53 in your notes, and in your stapled packet, it is on page 12. So for partial bed bath, at the very bottom, how many washcloths and towels will you need? 5 and 5. So for this one, you need way more towels because your towels have multiple purposes. They're just not used to dry. What are some other purposes for the towels? To keep them warm, and then to also provide privacy. He was so awesome. He is a registered nurse who was finishing up his master's degree, and so he had to come to us. It was during the pandemic, so he could finish his education, his clinicals. So I was his preceptor, and I hope he's doing well. I need to follow up with him and see where he's teaching at now. Yeah, and he had never been on camera before, so of course you hang around me, you got to be on camera. So it's a love-hate relationship.
Good job,
Yes, yes. And it's such a blessing to be in a position to where I can help new nurses and new students and everybody get to the next level. 2, 4. She like, you gonna be seeing me, Eunice. You're not getting away from me. Nope. My goal is to be here as long as you all need me. All right.
That you run into, and then they're just like lifelong partners.
I've had people at my door at 7 a.m. One lady, she was complaining about her job and she was serious. She was like, I'm going to quit. So maybe it was like 7:15, but she had just gotten off work and she came immediately here. And I let her know, I said, if you quit, if you let them run you away, really consider it, because when you get to the next location, you're going to have a similar person with a similar attitude. So I need for you to figure out how to work with these difficult people and to not get pushed out of your position. All right, we're going to speed it up. I just need a few minutes to set up your room. This is like a 20-minute video. It should not take 20 minutes to get someone a bath. It took 20 minutes because I was talking through everything. All right, I'm setting up your room. The mannequins go through it so that real patients don't have to. All right, we just dressed her, so. Yep, and on the video, on the video, I make sure I mention don't wear anything that's like hanging like what I have on there, because my jacket kept touching the bed. If they don't have a bath blanket, just use a towel. So for this video, I had a bath blanket. Not all of your facilities are going to have bath blankets. You have to use what's available. If your facility runs out of washcloths and your patient's dirty, you're going to cut up some towels. They could be mad later. But what you can't do is leave your patient there in fecal matter, because if the state comes in, they're going to be like, well, why didn't you bathe the resident? You had towels. You could have utilized those. All right, so what am I doing to her gown? Undressing without exposing her. I need you up there. I'm exposing this one. All right, side rail went back up because I left that side. At the test site, you are not tested nor filled on the absence or the presence of side rails. Removing that gown. How many towels do I have on that table? 5 and 5. Or if I only have 4, it's because we used the bath blanket. All right, I'm checking the water temperature. You can check the water temperature by dropping some water on your wrist. 1 towel goes on the pillow because you have to wash the face. Another towel goes under the arm. At the test site, you only have to cleanse one side of the mannequin. They know if you can clean one side, you can clean the other side. All right. Because the top, her chest, then her back, and then to dry. So it ended up being 5, but right now I just used. When you clean the eye, you go from one corner to the other and don't use the same portion twice. Then you can wash the rest of the face without soap. Use the towel that's on the pillow to dry. Check on your resident. Now you apply how much soap? 1 drop. It sounds like it's not enough, but that's what they require at the test site. You're going to clean her torso. Do you have to clean the whole upper body during the test? No, I'm exposing her chest just for video purposes. At the test site, you would lift that blanket like it's a tent so you wouldn't overexpose. You can use that same washcloth to keep washing the upper half of the body. If you felt like it was extra contaminated, you can switch spots or you can get another washcloth. The last part you're going to clean is the armpit. Why? The jerk, and then the smell. You don't want to put that smell all over her body. Now, after washing, I am rinsing. without exposing the resident. Now I'm going to use the towel beneath her arm to wrap and dry her arm. And I'm going to use her bath blanket to dry her, but when we're doing it in a few moments, we're going to use towels. Now I have to get her on her side so I can wash her back. Safe positioning. I move her towards me first. And then I go under and I turn her away. If you cross the legs, that helps them stay on their side. Curtains pulled. YouTube's probably going to flag me. I'm sorry, YouTube. It's a mannequin. It's a mannequin for educational purposes only. It's not a real person. Would you put that in the chat, Tim? This is a mannequin. Because someone's probably saying right now, you exposed a resident. That's a HIPAA violation. Now, when you cleanse the back in circular motions. Why? What does it do to circulation? For blood flow, yes. So circular motions. And then after you wash, what's the next step? Rinse with a new washcloth. That's why you have so many washcloths. Then after rinse, you can use that towel that's on their back to pat it dry. Yeah, you warm the lotion up in your hand. But for the test site, you cannot leave moisture on their skin. So what do you have to do with the lotion? Pat it dry. During the real world, bath time is a great time for you to do a skin assessment. For educational purposes only. Do not wear oversized jacket or scrubs because they might touch the bedding. You can start removing your towels. You put the gown on top of the towel or the bath blanket so you don't expose them. Do you wear gloves for this skill? Yes. Get your patient recentered back in the bed. I couldn't hear you, Dolores. Not for your state of Florida test. In the real world, in the real world, you would have to put a towel under their legs to prevent the bed from getting wet. But in the real world, you'd give a bath to all the extremities. So for your CNA test, they break the body up into increments. Upper, lower, peri care, catheter care, because they just let you do a whole bath. It wouldn't be any skills. You just have one skill. All right, I'm warming up some water and we are almost ready. Can someone set their alarm clock to 1 o'clock? Because I promise this time just be going by.
No sound on YouTube.
Mhm.
Oh, you got it on no sound?
No, it died. No, can you hear me now? YouTube, can you hear me now? We're about to do the skill now, Miss Dolores. It's time, baby. Miss Dolores and Miss Karen. Period. It's your skill. Go ahead and glove up. Oh Lord, we got this. We're gonna take care of the lady at the front bed. Yes. Oh, gee, you got this. You got this. Coming to the stage. Some of the best CNAs in the world. Amen. Yes, here I come. Okay, yes. I can't turn it sideways because this one right here or TikTok. Okay. All right, everybody.
Doing just one side.
You're doing just one side, but for this skill, doing the test everybody, and you ladies are welcome to have a chair if you don't want to stand. It takes about 10 minutes. For this skill, one of you would be the nurse, the other would be the CNA. So at parts, I'm just going to have you both work together, but then I'll separate your tasks. Okay. So I have on the table, I have the way I like things set up, which is not requirements. I'm going to move it forward a little bit so you all can see. So I don't know if you just saw that water splash. So I always put a towel on top of my bedside table because anytime I have water, there's a possibility it's going to spill. So that's why I have that. And then I have 5 washcloths and 5 towels. This is the type of cleanser you might see in the medical facility. It's shampoo and body wash. You use the one thing for all their body. Okay, so it's not going to be as specific as where you just have a bar of soap, unless you brought that bar of soap in from the supply. At the test site, everything's going to be liquid. Body moisturizer. So, yes, ma'am.
I have a question. So, when you start working in a facility, if you don't like some of the
Can't. Old school CNAs used to bring in like their whole crates with all their stuff, and all the patients loved it, and they still great. They bring in talcum powder and all this other stuff, and so your patient smells beautiful. But if they get a reaction, if they have, you don't want to be risking your license. So if the family member brings something in for that client to use, that's totally different. But now you're taking your lotions from room to room to room, and now we're trying to figure out how these patients keep getting these infections. It's probably your contaminated supplies. Right. So no good deed goes unpunished. Right. You do something good and someone's gonna complain about it. Mr. Lawrence, yes, you just set at your table.
Yes.
I don't know if you want to put into position first or get your towels first, but whatever you do, your priority, after you do your intro, is to have your nurse do what that water. Test. So go ahead and pick up the water basin and 2 hands and just present it to your nurse and ask her to check the water temperature.
Can you check the water too?
At the test site, your nurse more than likely won't have on gloves right now. Oh, look at her. Is it comfortable for the patient? Good. Awesome. So now you can begin with your
Towels with the head of the pillow.
Yeah, so you'll take her head, gently raise it. I'm going to ask her to give you a bath.
Help assist you with your bath. I'm gonna lift your head. You don't care if I touch you. She said yes.
Good. Good.
I can't touch
You can't touch her bed. No, good job.
So I have her.
And while she's up, go ahead and untie her down. Beautiful. You can just untie it.
Yes.
You can let it down now, now she hurting.
Uh-oh.
Uh-huh. All right, and so with the sheet, if you do decide to pull it down because you're not cleaning her period area,
Right.
just pull it down to the lower half of her torso.
And then what about I'm trying to think about my thingy on top. My
Pinky on top.
my
You
my
can take it
bed.
down.
Okay.
So here you go, but you're still not
necessarily take her entire gown off until she's covered with something. So
Okay.
there's a towel for your mouth.
So I'm gonna cover
And don't shake it. I know it's gonna be hard. Don't shake it.
her upper torso
So,
area.
here we go. Let's do it the long way.
Oh, the long way, okay.
And so you're gonna cover her. There we go. And so now you're gonna get your next towel.
It's
this
gonna
was-
go under her arm.
This one's for under her arm. Perfect. Now she being extra. She done put down.
We're gonna take this on it, girl. Are you comfortable?
Yes, I am.
Awesome. Let's get you going. Want to lift her up and I'm gonna.
And so now you can start undressing without exposing her. And you don't have to push it under her, it's just under her arm. Just lift her arm, because you don't want to put too much under her.
So what I'll do is go ahead. Make sure that stay under. Make sure I don't touch the bed. The bars do not touch the bed.
Yep, just focus on not hurting her with that arm right now. Remember, look how you bend her arm. Okay, so just move the gown more.
Move the gown more.
Like, there we go. That little nippy out, Dolores. It's a little cold right there. That little nippy out. Look at you. What you focus on? Focusing on her hand. There we go. All right, so now you can sit up straight.
Okay.
Now you walk around the bed, and I want you to repeat that process on the opposite side.
Okay.
Yes. you-
Okay.
So,
You want me to go around? You want me to go?
so there you go.
Mhm.
At the test site, you only have to do one arm. I just want to make sure that they both get a chance to practice. Remove the arm off of the gown off of the sleeve. The gown off of her arm, excuse me, without exposing her chest. And I know it's hard. You can't help it. I know it's hard. Yep. All right. And so now, Miss Karen, you are going to make a tent with this and pull the gown down. Make a tent so you can see. You need to see what's under it. How can you see? You remember how we made the tent with the linens? There we go. And pull it down. You're not taking it off. You're just pulling it down.
Okay.
Because for the test, you only have to clean the upper half of the mannequin. All right, so this is a little bit hot. I'll get you one more towel for her back, and if I didn't say one of your towels, she's gonna take them. That's not a requirement. All right, why don't we move your table? There you go, Mr. Laura.
Okay.
You got this.
So I'm gonna come over. Get my supplies. Well.
And I only put about 2 inches of water because it likes to spill. And so this is now going to go over your bed, open end over your bed. And if it hits her leg, you can raise it some. And the lever is on the closed end, so the lever's down here. There you go.
Okay.
And now come back over to the side that you were on. Beautiful. And now straighten this out. So it's
All right, so I'm gonna start.
get your water.
The
So-
temperature has been checked. We'll start with the face.
Yes.
Okay. No soap.
No soap. Hold it one more time for me. Good. Wet it, wring it out with 2 hands. And when you cleanse an eye, I'm just gonna sit her up a little bit for the camera. When you cleanse an eye, what direction do you start wiping from?
From the inside.
Inside out, okay, from the end towards you, so go this way. And pretend she closed her eyes. Go ahead.
All right, so I'm gonna start with your face. Are you comfortable?
Yep, she closed her eyes. Good. I can't do twice. Cause if she had pink eye,
Oh,
you rubbed it back in there. So
so
just go one time.
just go.
In
One.
and now change positions, pull back the corner. So if you do it from this way, if you have the leaves of your washcloth up, it's just pulling
I
back.
could just be like I'm like peeling back.
Yeah.
Got it. Okay. So start with your eye.
Good. And now peel back. And now repeat the process over here. So it looks like you got more for forehead, and for you want to make sure you get her eye, very specific for eye. So it's a lot of this is about perception. When you're taking your test, you got a nurse who's watching you do stuff.
Okay.
One eye.
One eye. Peel it back.
Pretend her eyes closed and go from here to here. I think you're trying to go around.
Oh, I am. Okay, so her eyes are
here.
closed.
Yes.
Here to here.
There you go.
Go ahead and pull it back. From there
Here to here.
to there.
And why do we change positions? To make sure we don't create an infection. And now you can clean one side of her face, if her eyes are closed. Okay, you get that ear too on the side that you're at. So for the face and the ear, don't stay awake, Christian. Stand up, Christian. Christian, I watch everything you do. Our classes are too small for you to fall asleep. Can I go ahead and focus? Yes. And you can reach over the bed as long as you're not doing what with the uniform. Touch it. Great job. But she's smiling at you. You can put your used washcloth. And now you're gonna take this towel and you're going to dry. I'm sorry, this is dry face. Start with the eye, and then you can pat dry the rest of her face and pat dry her ear. And if you didn't feel comfortable reaching over, I would have Miss Karen do this side over here. So if you'll dry that eye. Sorry, I have a lot tonight. You have a question? Can I get some good coffee? Thank you. All right. Your patient feels wonderful. Now you're gonna wet your second washcloth. You're gonna wet it, wring it well. And apply how much soap, King? One drop.
So I'm going to fold this like this. One drop of soap.
Good.
Okay. So I'm going to then, I don't want to overexpose.
Perfect. So neck first.
Neck.
And if you all can't see, she's literally wiping the neck. And then from there, she's doing lower throat. She's going down to the chest.
I would lift the breast, you know, go underneath.
Oh, you're thinking she has a lot of breasts, but it's okay.
Go under.
All right. Let's lower the towel.
Yeah.
Now you can focus on her arm. So go all the way down. Get that back of the hand.
Yes.
And now lift up. You can, yep, and now clean the rest. And even though she only has soap on one spot, it counts for the whole back. Good. Once she hits that armpit,
Oh, yeah, the armpit, that's it.
that's it. Yep. So you're going to watch that side. You're going to do that. Now that towel.
And then,
Start over.
oh yeah, because I hit armpit.
Yeah.
Let me take a bite first.
Okay.
Correction. Correction.
After she just did the chest, is it okay if like dry the chest and then move through the
Because you have to rinse before you can dry. And so that would need a new whole new washcloth.
Oh,
So wash, rinse, dry. So once she's washed.
All right, y'all, check this out. It's gonna be fabulous.
Okay.
Okay. I did that neck. I did that torso.
Good.
Right. I laid it down. I came all the way down on the arm.
Now you missed a part of the arm. That's okay, Sean.
All the way.
So here, have to washcloth like the long way. Let's go ahead and clean her.
Oh, yeah. Okay. So I'm cleaning her arm.
So she has an IV. So in the real world, we would not be.
I wouldn't touch it.
You wouldn't touch it, but you can clean those fingers.
I can go to those fingers like that.
And then she can rotate.
And once I go under,
You missed the whole part of the arm. Now you're going to work your way.
back down,
Yeah.
go down.
Oh, she says that feels good. Look at her skin. Fantastic. I say you're going to hit this day.
I hit that pit and then Kavingi and the thing doodle.
That's right. And the thingy madoodle.
And now I am going to rinse.
Yeah.
So I'm gonna take a clean cloth. I'm gonna
I
wear
don't
it.
know if y'all see Nicole over here. She like a whole nursing body with her. She like y'all doing everything you're supposed to do. Good job.
All right. So I'm gonna fold it. I'm gonna rinse. I will rinse everything that I just cleaned. All right. All these good videos go all the way down.
There we go. All right, you good. So now with the towel is on her chest.
I prefer you don't use the palm of your hand when you're around sensitive areas. So like you can maybe palm this part right here, and you can palm this part back of your hands on sensitive areas. Okay. Mhm. Good. But at the test site, make sure she's really dry. Cause like if you used a lot of water, cause like you didn't dry the armpit, just go in so that nurse sees everything. Go dry the armpit. And so you can lift up the arm. So here it is. So now just yeah, yeah, and don't let anything touch you. Perfect. Now, girl, you ain't trying to spend 31 minutes on this one skill. Let's go. And now you can wrap her once you dry the armpit, and that's going to keep her warm. Mm-hmm. Keep her wrapped. Good. And so we just had you put that towel over there. It's really not needed for the test. So to switch you all out, I'm going to get you all to change places, and you're going to clean the back, Mr. Lewis. I apologize. Miss Karen's going to clean the back. That's why I had you all switch out. And so what position do they have to be in before we turn them? And I raised her up just for camera purposes. So if you'll lower the head of her bed, it's near you. It's at the top. She would stay flat the whole time. I only did it for the camera. The only time you'd have to do this with the head of the bed somewhat elevated is if your person has a problem doing what? Breathing. Automatically, if they have a trach or if they have a gastric tube is how they're getting their nutrients through their stomach. If you didn't pause the machine, you can't lay them flat because that food can travel up and make them aspirate. Okay. So team turn. You're going under and she's going over, but you have to talk to each other. Remember, when you have a team member, you don't have to do all that. You don't have to when you have a team member. Okay, so you're gonna go over, making sure you also get the arm, and you're gonna go under. Make sure you get her hip and her leg. 1, 2, 3, up, and now you stand up straight with a straight back. If you need to bring her buttocks back towards you, Miss Karen, you can do so. Grab both hips. Trust your nurse. Your nurse is not gonna let your patient fall. Good. Okay. And now you don't trust your nurse. She's not gonna let that patient fall. Her head is close to the edge though. Okay. There we go. All right. So now put let me get you one more towel. That's my fault. Like Nicole, like her head is kind of close to the edge. Your nurse is in training. We're getting her there. All right. So now you're gonna put a towel. Good. Patrick enjoyed his day. Patrick got fed, his hair was shampooed, his teeth was brushed. I know Patrick missed Nurse Eunice. All right, good. All right, so when you turn the resident to the side, what's the question you should be asking? Are you comfortable? Are you okay? All right, and so your nurse could be looking, but you also want to acknowledge it. Yes, most of the time your nurse is going to be willing to help you, but if you don't ask for the assistance, they won't help you. So here, let's do small circles. There we go. Good, keep going. Your patient has a gunshot wound to her back. I'm not seeing any questions. I'm not sure why it's back there. All right, good. That was washed. What's next? Rinse. Yeah, when you all leave here, you feel like you worked a full day, right? Yeah. I sometimes have dreams where I've like worked the whole in my sleep. Like I've worked a 12-hour shift in my sleep. Oh, and I wake up and I be so tired because my legs to move the whole night. So yeah, it's like I'm being a patient advocate. I'm fussing at people. I'm giving baths. I'm like, hold up, I didn't sleep last night.
She's still okay, but you have two hands with lotion on it. Use both. There we go. Oh, that feels so good. Thank you. Yes, ma'am. Mm-hmm. For the test, you only put it on the back. Hold up, before you all lay her down, you laid her back on that towel. So start preparing to remove towels. So this is just for the test. For the test, you only put the lotion on the back. In the real world, you put the lotion wherever the patient wants the lotion, or wherever you see there's a need for lotion. Still, the pillow too. I would go ahead and move that one. So you're just being proactive. So you don't. Otherwise, you're going to have to keep moving your patient back and forth, back and forth. They don't like moving that much. Okay. All right. So now you have receiving hands, Karen. So so let's say this patient's 500 pounds, and you have your hands way down here. They're going to roll on your hands. So receiving hands is your kind of here, so you can easily remove your hand. And now upside down. There we go. And now when you roll it back, you can easily slide your hands from beneath her. If you go deeper, they're rolling on your arm. Okay. All right. So go ahead and start separating. Do not remove the towel from the chest. The towel from the chest is the last one it goes. Lift the arms. Talk to your resident. So you're not supposed to pull things beneath her, Miss Karen. That's why I told you to lift her arms. When you pull things from beneath them, they say that you're shearing or tearing their skin. I catch everything. Okay, great. Now you all can, and I'm going to you all can work together to put the gown on without overexposing your resident. Mm-hmm. Pardon me, dear. I apologize. All right, so I have your laundry basket right here. And you can take your towels individually to the laundry basket, or you can do the whole roll away. Mm-hmm. Yes, ma'am. Now that's the longest bath ever. If y'all take that long to give a bath in the real world, the patient hasn't pooped, we firing you. Be like, how long did it take you to clean her? Yeah, you got to move faster. Mm-mm. You'll learn how to move faster. You'll learn your time management. All right. So Nicole, would you go into the restroom with Karen and watch her cleanse this? So we're gonna dump, rinse, dump, dry, and when she stores, she'll have to use a napkin. So go ahead. And then Dolores, you can take your individual towels and put in your laundry basket. Don't let anything. So I wouldn't try to get everything, just the big towels first, and keep everything away from you. So gather up. Gather, lift up. Okay, beautiful. And now, how do you remove this base towel? Oh, you can go ahead and put that one in the laundry basket. When you take this off the table, do you take it towards you or away from you? Beautiful. All right, if you'll stand right there and take off your gloves. You got it. You worked hard today. Beautiful. All right, what comes next? Let's put it in her hand. All right, so go ahead and expose her hand. Bring it out. There you go. Yep, she said she is. She's good. Hands are clean. Good. Awesome. And then how do you know if you need to document? How do you know if you have to document for your test? What would she give you?
Beautiful. You're out of here. Let's see how you store that. She has it. What? Y'all are ready to pass this test. Yes, ma'am. And let's watch you take off your gloves. I know it's fine. Some people's hands are sweatier than others, so you may have to like milk it off, like in increments, pull it off so it doesn't pop. You got it. It's okay. Keep going. You got to get it off. What would you say at the test site if that happens? Correction. You pinched it. You don't pinch. You go 2 fingers under. That's why I watch everything you all do. 2 fingers under, and you're good. And you can do it right over the trash can in case it flicks off. All right. What comes next? Hands are clean during your test. If it got snug on your wedding ring, don't wear your wedding ring during your test. A lot of nurses wear like the silicone rings, the plastic rubber band. All right. What comes next? Really give it to her. Put it in her hand. Whoopsie. We'll take that. All right. What comes next? Okay. Open her curtain. Not at this time. Yeah. You gave it to her. And as long as you did it before you said done, you're good. Okay. Everybody did well. Let's go read. Sorry, we got like 2 hours left and probably 3 skills, so we got to keep going. And who has to leave early today? Like who has to leave before 1:15? We're good? Okay. And someone set their alarm clock for 1? Okay. Look like 5 of y'all. Yes, ma'am, we did. So partial bed bath, if you'll read practice a skill that starts on page 55. Very good. Very good. Thank you for putting that note in there. All right, everybody. Any questions there? While I'm setting up, take a quick 5-minute break, use the restrooms. We come back, it's time for perineal care. Switch out these mics soon.
All right, Miss Gertrude, you're the heavy one. They were like, why was Patrick in the diaper? Patrick enjoyed the care that he received during his stay. I know. Patrick got fed, teeth brushed. I know. I'm just here. I'm on break. I can turn off my mics. Hold on. Let me turn them off. You all will be right back. Hold on, hold on, hold on, hold on, hold on. Let me see what I got. Let me turn off the mic. Let me turn off the mic. What? Okay. Okay, thank you. Woo, woo, woo. Okay, I'm gonna make sure I say thank you for ordering the book because I haven't mentioned the book. Thank you. Like I said, I'm gonna miss y'all. Y'all is so. Oh, I know we stuck together. We stuck like Chuck. All right, so now the mic's back on, everybody. Okay. All right. I got to set up these 3 stations. And for all my oh, why isn't this one on? Let's figure out what happened here with this mic. We need this mic to be on. All right, let me press this, take it out, and put it back in. Now we're green. So for everybody who has purchased our book, I just want to say thank you so much. So in addition to the people who are in-house, thank you for purchasing the book. For our TikTokers, you all have been killing it. Thank you for purchasing our CNA book. So if you want to learn your skills step by step, have medical terminology and a practice test, you can buy this book in our TikTok shop or also on our Amazon store. So that's when I first started, you all. Oh, let me let y'all see me. Let me let y'all see me. Hold up. Go ahead, girl. Where your face at? It's still going 2 times as fast. Come on.
When you first started doing it.
Uh-huh. Yeah.
You said the video was from 15 years ago. I said 15 years.
Yeah, that was 15 years ago. Oh, them was the good old days. Oh, who would have known? So I got a funny story to tell about that video. Y'all know Master P, right? So I used his marketing style. I was selling those videos out of my trunk, like because I had DVDs. So I had like the DVD burner and everything. I made so much money off that $500 video. I had like a whole production. That's like when they had the cameras on top of the shoulders. But I had to put the video on a digital platform, and I chose YouTube. But I will only let my students see the link. And so by the time I decided to go 12 years later, like, hey, let me start showing people these videos. I already had enough views to be monetized on YouTube, but because they were private, they didn't count. So I saw somebody doing something I considered unethical. It was somebody going around just saying, "Hey, I'll teach you how to do CNA," and it was somebody who wasn't a nurse. And I was like, "Well, I'm not going to let somebody unethical because you're not teaching teamwork, you're not teaching care, you're just literally teaching skills." And that's what's wrong. A lot of people can pass a test, but they don't care. They're just in it for the money. So I'm like, before I let somebody else teach the world, I will stop making my videos private. I'll make my videos public and I will teach everybody. And God honored that commitment. So that is the story as to how I am the CNA nurse on YouTube. Because I've been on it for a long time. I just wouldn't let everybody see me. Because I only wanted y'all to pass, like, just my babies. Yeah. But we're not gonna let Bonquisha them be teaching CNA classes. They really don't care. And they don't teach y'all how to work with a nurse. Nurses and CNAs are not enemies. We work differently. But if they can keep us apart, but like, don't be listening to that nurse. They can keep us apart, and then you got CNAs who overwork their nurses. So I have to teach everybody, because at the end of the day, that patient needs to be cleaned, and that patient doesn't care who cleans them. Do you know how to wipe front to back? And if the answer is no, that's because you went to Bonquisha. No, we have to learn how to work together. And then for the nurses who started off working as CNAs, they are much better nurses because they understand how to work as a team, and they're not going to try to put all that work on the CNA. Mhm.
About how she does the wound, like the wound back, I think.
Mhm.
And somehow they can take up to 3 hours just to do one wound. And one patient she had, they just don't ever take their time. It just stays beeping all the time. She was traveling at the time.
Well, wound care is really hard, but she's absolutely right. A lot of nurses would just be like, "Oh, we're gonna call the wound care nurse for that." So that means the patient's in there with the machine beeping, and no one took the time to put a new seal on it, do something to it, so she can't turn it off.
She did it at one time and it never even wanted a different nurse.
Mhm.
Gotta take your time.
But you all are going to be the type of nurses, CNAs for now, but nurses for now, where you're going to accept accountability and responsibility. It's like, well, if the wound care nurse can't get here for 2 hours, what can I do now between the time the wound care nurse gets here to make sure this machine isn't beeping? As a CNA, your role is limited. You can only do so much. But as a nurse, maybe you should try to take that in service that they offered you that you didn't really look at, that showed you how to take care of a wound care vac. All right, so everybody, our next skill is perineal care. For perineal care, would someone go ahead and tell us what page it is in your stapled notes and your packet? So 56 and 13. For the state of Florida examination, you are performing perineal care on a female. So the acronym I like for you to remember is VRB. I want you to write this down. VRB. V as in vagina. R is in rectum. And B is in buttocks. So during the CNA exam, if you have perineal care as a skill, what are you cleaning? The vagina, rectum, and the buttocks. What's the cleaning process? What comes first? As far as like the steps, wash. What's after wash? Rinse, and dry. So anytime you have a washcloth, that's the process. Wash, rinse, dry. Wash, rinse, dry. For this skill, and this makes absolutely no sense, I just need you to pass your test. For this skill, you're going to pretend as if the pad is wet. And without cleaning the resident first, you change the pad first. So when you read your stapled notes, the quick packet, it's going to say change the bed pad first. That makes no sense because in the real world, that means you be putting a patient with a dirty vagina on a clean pad. I just need you to do what during this test? Just pass the test. Yep, change that pad first. We know it doesn't make any sense, but we didn't write the test. We just need to make sure that you pass the test. Then at the end of the skill, you can keep that pad that you changed beneath them as long as you do not get the pad wet. So I'm going to teach you to keep drying your hands. If I see water dripping, I'm going to fuss at you with love. Oh, y'all saying that now until y'all going to hear me fussing at you in your sleep. Miss Eunice says, stop contaminating my uniform. I got to get one more bath basin and we are ready. All right, so for this one, we'll go ahead and read practice skill before we get started, just so we make the most use of our time. Will someone read practice skill for perineal care? Tim, can I get you to put about 4 inches of hot water in this one? It's the one nearest the door. Just that one.
Is at a safe and comfortable. Apply soap directly to a wet washcloth. Use a soapy washcloth for cleansing. Change spots on the washcloth for each washing stroke. Wipe from front to back with all washing and rinsing strokes. Remove all soap from the perineal area using a fresh wet washcloth. Change bottom washcloth for each rinsing stroke. Clean skin folds of perineal area. Dry the entire perineal area from front to back after completing cleansing and rinsing. Replace the basin of water during the task if it becomes cold or soapy. Position the resident on the side for cleansing of the buttocks and rectal area. Cleanse, rinse, and dry rectal and buttocks areas. Adjust limbs to avoid unnecessary exposure of the resident outward. Leave resident on dry underpad at the completion of the procedure. Rinse and dry basin, store equipment and dispose of linen and trash when the procedure is completed. Remove gloves or use a barrier to store the equipment.
All right, beautiful ladies. So what I'm going to have you all do is we're going to divide and conquer. It's going to be 2 people per bed. I probably don't need these here just yet. I'm going to move your table a little bit back for now because we have to focus on changing the pad first. Thank you. If you'll just pour about 1 inch of water into that one, 1 inch, maybe 1.5 inches. So that water is going to go into 3 different containers. Good. That's some more. Beautiful. And now there's a bowl, a basin beneath that one. Everybody, because we're in a classroom environment, if your water does get cold, when your nurse checks the water temperature, just say it's still warm. Because in the real world, you wouldn't get your water until you're ready for that nurse to check the temperature. These are not long enough. These are 1, 2, and 3. All right, let's go, everybody. We have 3 stations. We have 6 patients. So I need 1 person on the left of the bed, 1 person on the right of the bed. Left, right, left, right. Test site. Your nurse might not help you turn a resident while you're placing the pad. Real world. No one may be available when you're changing the pad. I can try to move this bed over just a little bit. Pardon me. Hey, Christian, would you undo the brake over there? It's at the top of the bed, I'm thinking. That's on a wheel. Probably do it with your foot. It's going to be easier. You don't see it? Maybe it's at the foot of the bed. Should be a brake on that side. Look at the foot of the bed. Look for the wheel that has a brake on it. No, there got to be a brake on that side, Christian. Use your foot instead of your hand, Christian. Your foot's going to be stronger. Something's in the way? Okay. That's the rail. Bring the rail up. Bring it towards the foot. Bring it towards the foot. Bring it up. Use your foot to Y'all, she got on Uggs. Okay, move the whole bed over. Let's move it. 2 hands. Let's move it. Move it, move it, move. Pull. Pull. Yeah. Okay. She's just a giggling polar patient. Okay, so we gave y'all a little more room. Would you press on that brake? You pressed on your brake? All right, now you can let your rail back down once your brake is activated. All right, everybody. First, it's going to be team turn. If you put yours at the very bottom. And because you have help, you're going to turn the resident away from you. If you don't have help, what has to be up? The rail. So team turn, get your resident towards you. So you'll be on this side over here. You're fine. So she can go first. Everyone who's on the right is going to be the one who's applying the pad. So you're going under. So you're going to be up there. You're on. Yeah. Work together. You all talk.
She's gonna pull the resident to her up.
You're going to push and she's going to pull. So you go under,
Okay.
but she's not listening. So you got to help direct her.
Okay.
You're going under and she's going over.
Okay. So I'm gonna go under.
She's just listen, baby. Go over.
So I'm
Go
gonna
over.
pull the resident
Go
closer to me.
over. Take your hand. Go over.
Right, and I'm gonna turn towards you.
Good. All right. Now get your patient recentered in bed if you need to. Get them recentered. That means that you just pull them back a little bit. And when you pull them back, hips, get them back towards you. That's not a hip. That's a shoulder. Hips with an S. Pull them back towards you. Come on. Good. All right. And so for video purposes, cover up their butts. I don't want to get flagged. All right. I need you to keep her on her side, Dolores. Or I'm sorry, I keep saying Dolores. Karen. Now roll this in. Roll the dirty pad in. Roll the dirty pad in. Push it under. Like exactly how you did the sheets. Now get your new pad. Roll it in halfway. Cotton side. And so whenever your orientation for your pad, everybody, is your pad should go from one side of the bed to the other. So if you roll it short, it's not going to go. So think, okay, if I want this pad to go from one side to the other, I have to roll it the long way. So roll it the long way. Yep, the roll side would go towards the patient's back. Like good. And then I'll show you what you're doing over here. Towards them. From you, roll side towards them. They have to go over. All right. Good. All right. So and now for the task, you have to walk around. But for classroom purposes, your partner is now going to become a nurse. So your partner goes over and you go under. But she knows not that she went over. Come on, watch your head. Did she really have to push? Because I'm getting the bed if she didn't. All right. You can't do two at once. Take away your dirty. Take away your dirty. Awesome. Take away your dirty. Take away your dirty. And now roll out your clean and get those wrinkles from beneath your resident. The wrinkles I'm referring to would be the sheet, or the blanket, or the gown. Good. All right. And now you are going to help recenter them in bed. I love how y'all pause. So now sheet up to the knees. Sheet up to the knees. And I'm going to give y'all an extra towel because I don't feel like getting flagged on YouTube today because this is live. And I know it's about to happen. Someone's going to be like, oh my God, she exposed a human. These are not humans, you all. These are mannequins. I got to figure out how to show them the privates without getting flagged. So I got an idea. For now, if you all, the tables are going to cover the privates. Yeah. And I'll give you all the extra towel also. So if you all would bring your tables over, remember that sometimes there could be a wheel or something under the table. So you're literally looking under the table and above the table at the same time, below and under. Let me get you all 3 more towels. So for this one, instead of it just being 2 towels, if you want to provide extra privacy, put a towel over their groin. Okay. Okay, good. That's good right there. All right, so towel over their groin, and then you can raise the gown. So you can lay it flat or however, but as long as the gown, so that you can get access to what you need. Okay. Uh-huh. So lower the towel, like literally, like, oh, that's not a towel. That was the issue. For now, take this towel, and I'll get you another towel. Okay. So you're fine with just lowering the sheet for right now because nothing's going to be exposed. So bring the sheet back where it was. Place the towel. Okay. Raise the gown. All right. So now she's warm. She's protected. She's not overexposed. I know for classroom purposes you don't have on gloves. If you want to put on gloves, you can go ahead and do so. During your test, you'd have to have on gloves. Your back, I just saw you. You can come down here and you can crank your bed up, pull out your handle, pull it out, and now you have to figure out which direction you crank it. So, so there we go. So at Nurse Eunice's nursing home, we have cranks. Your bed actually does have, it's electronic. So if you pull out your rail, pull your rail out and up. Height is on the outside, head of the bed and up and down is on the inside. So you can actually raise your bed up. Okay, just raise this up some. You don't have to move, just raise it up. Good. Are you all okay with your height over there? Oh my God, I fell. Why did I fall? She didn't put it back in. Put that crate back in, Miss Karen. So take it back under the bed. Take it down. It literally folds back into, so you see how this one right here, it folds back under. There you go. So everybody, if you have a test question about the crank that's on the bed, when you get through cranking the bed up, you have to tuck it back in. All right, so our CNA, present your water to your nurse. Oh, you're a nurse. Sorry, no problem. Okay. Everybody has on gloves. Everybody has on gloves. Perfect. Go ahead and raise that towel. And I'm just gonna move your table a little bit. My nurses can't do anything until the CNA asks for your help. Okay. Oh no, now you can raise a towel. So the nurse only helps with positioning. So nurse, drop the towel. My CNA can move this towel. Go ahead, CNA, move this towel. Move the towel, open their legs. Move the towel and open the legs. So nurse, you don't open the legs. Nurse, you stand right there. My CNA got this. Move the towel, open the legs. Good. Move the towel, open the legs. Everybody pick up a washcloth. Wet it, wring it, apply 1 drop of soap. Pick up a washcloth, wet it, wring it out well, and apply 1 drop of soap. Once you have soap on your washcloth, just gently pat your hands on the towel that's on the table, because if your washcloth is dripping and you get that pad wet, you're dripping. So what you're going to do is you're going to take your hands and do this, your gloved hands, and that way you make sure nothing's dripping. So everybody, when you wipe, you're going to wipe with the corners up. Wipe with the corners up. Pull the peels. So if this is a flower, you're wiping with the corners up. It's outer, center. So everybody go down one side first. One side, go down. Peel back a corner. Go down the other side. Peel back the corner of the washcloth. And go down the center.
That's it. Ain't no drainage. It's not a real human. The more times that you keep doing it, the more likely you are to make mistakes. Because if you write back to front and you don't say correction, even though you write 10 times correctly, that one time they will fail you. What's next after washing? Put that washcloth down, get a new washcloth, wet it, wring it, dry your hands. Do not apply any soap. Ask your resident if they're okay. I'm good. If I would have came faster, I wouldn't have peed on myself. All right, and so now repeat the process. How do we clean the vaginal area? Outer, center. So outer, then peel back, other outer. And so I see what you're doing, good. And then peel back, and then center. Good job. All right, you can use the towel that's on the table because you don't no longer need that washcloth. Use the towel that's on the table. Don't let it touch you when you pick it up. You can't let it touch you. Pick it up and you can let one end dangle on the bed. You only need a corner. Remember, they're elderly. It's dry down there. You don't want to put a whole bunch of material between their legs. So open up your towel. You only want one layer, not a whole bunch of material. And it's okay to let it drop on the bed. You can't touch the bed, but that clean towel can. And you're going to dry going down gently, the same way you washed and you rinsed. Outer, change position just a little bit. It doesn't have to be anything major. If you're overthinking it, you're overthinking it. Just move faster. She doesn't want you down there for too long now. And now just move a little bit and change. Great job. That same towel we're going to use on her rectum. So you can put that towel back on top of the table because the table has a what on it? A towel. Yeah, put that back on the table. Cover her up, pull down her gown in the front because it's no need to keep exposing her front. And so if you want to take that towel from the front off, you totally can. Once the gown is down. Look at the nurse. The nurse over there just has to help you. All right. It's hard just being the nurse, just standing there. All right. So towels off and towels on the table. So now we're going to do, you can either raise your table up, which is what I recommend, or you can move your table in its entirety, but we have a small area. Let's raise it up. Okay, good. You okay, Nicole? You can just move it if it's not. So now you're going to do your team turn. Your nurse over here is helping you without you asking her, so she hasn't stopped. At the test site, if you do not ask your nurse for help, she will not help you. She will stand there with a clipboard. So communicate with your nurse and ask your nurse for assistance with turning. Okay, good. Go over and under. If your CNA doesn't help you turn, lower your patient back down. And then straighten out those hips. Get those hips closer to you. Good. Make sure YouTube isn't seeing too much because I don't want to get, I think we're good on YouTube. We're good. All they can see are tables. All right, so you can move your table back up. Okay. All right, ladies. You should be okay. You can expose because you need to see what you're watching. She can't see nothing. Sorry, YouTube. You can't see anything, but you can watch the video later. We have a full recap. All right, so you all know what to do now, right? Okay, good. How do you prevent that pad from getting wet? What's up there? Yeah, she holds. Remember, she has the resident. So now you're going to use your unused washcloth, wet it, wring it, and like if your table's too high, you can lower your table. Wet it, wring it, apply how many drops of soap? And what I want you to clean is the rectum first. I call this crack to the back. The slit that's between their buttocks from the vagina up towards their back. Crack to the back. For a human, you would keep doing that until what? Everything's clean. You're going to use that same washcloth because this is just a mannequin, but you have to peel the corner back to go up one buttock, peel back to go up the second buttock. And we're always going up. Okay, and so if you have this going the wider way, you can get more coverage. Okay, good. Peel back. Good. And so same thing I'm gonna show her. I'm gonna show you also, Nicole, is if you have a washcloth going this way, hold up.
this way, you get more coverage because it's like the whole washcloth is cleaning the butt out. Here I come, Nicole. So if you have the washcloth going this way, you get more coverage on the buttock. Okay, I'm not sure which way you were, but they're the opposite way. All right, so once you have cleaned both buttocks, it's now time to do what? Rinse. So, it's vagina, rectum, buttock, BRB. So now it's time for you to get your last washcloth to rinse. Yes, ma'am. Not on the rectum, but it would be rectum once, buttock once, the other buttock once. Make sure those hands are dry so you don't get that pad wet. You get the pad wet, you have to start all over again. You rinse the same way you wiped. Did you rinse the rectum? Okay, perfect. And then when it's time to dry, I like to say, don't be down there patting stuff. So we pat other areas, but imagine if somebody was drying you and they're down there patting your private area. So it's going to be a gentle wipe, a gentle wipe up when you're drying. And then if you do have to pat their buttocks, they say it's excoriated. Do you use the palm of your hand or the back of your hand? The back of your hand. Good. Okay. Good job. During the test, they're not requiring any ointment or any paste to be put on, but sometimes they have butt paste in the facilities. You would apply butt paste if it's required. Okay. And then for you ladies, just make sure there's no wrinkles in that pad. Make sure there's no wrinkles in that pad. And over here, we're still going. Okay. And you would have receiving hands. And for everybody on TikTok who ordered a book today, those books will be shipped out before I leave today. So we're going to get those books shipped out. Thank you all for watching. We have 2 more skills left. YouTube, especially our channel members, we appreciate you. So all these videos are in the private portal. They will not be reposted or reshared on TikTok. So the only way you're going to be able to see these videos is if you're one of these awesome students or if you're a channel member on YouTube. Hey! All right. If you raise the frame of your bed, what do you have to do before you leave this room? Lower it. For classroom purposes, just help me reset these tables because we're going to use these same tables and washcloths again. So look below. Remember I told you when you're moving the table, you have to look above and below. So you have to raise it up, pick it up because it's on top of that cord. Use your foot to help you. Uh-oh. Okay. All right. Fold everything back up for me. And then you would, of course, we know how to clean. We know how to take our linens away. You would wash your hands and you would be done. Take any notes that you need to take. And if you have any questions, I can answer them now. She does. She done got dressed, undressed. She got a lot of care today. And then I don't remember, Dolores, did you raise and lower your frame? I wasn't watching. Okay, perfect. Did you lower your bed? Okay, awesome. Love it. All right, so you all can go. We already read. If you need a quick break, you can take one because I have to catheterize the mannequins. Thank you all so much. Yes, ma'am. Yeah. So we're gonna answer that question. What I'm gonna do to remind us that we have to answer that question. So I'm putting it right there. Go take your break. When we come back, yeah, I'll tell you exactly what happened. Great question. And my answer is gonna surprise you. Yeah. I'm gonna take off her wig so that now she's a man. Okay. I'm sorry, dear. Logan, do you have any coffee that's already made? Oh, never mind, Logan. I'm good. Pardon me. Thank you so much.
Mm, I kind of do them together. So we'll start with the catheter, but when we do the skill, we do the catheter care first, and then we talk about the bag. And let me set up these stations again. And then after we get through with catheter care and drainage bag, are we done? Was that everything? Look at page 5. So y'all got 2 more skills, and you learned all your skills for your test. It's bittersweet. Well, you deserve a day off because you've worked. You've done a lot this week. Well, when you pass your exam and you're going to put in your 2 weeks notice, let them know where you went because I already know your mom has a job lined up for you. Very good. Yes. Mhm. Very good. Mhm. That's right. If I was her, I'd focus on wound care. I would focus on something that a lot of people that I'm doing on YouTube. Um, a lot of people call me for wound care, and it's not something that I offer yet because I don't have a wound vac. But as soon as I get a wound vac, it is on. So Tim and Logan, if y'all want to be looking for us a wound vac, because so many nurses need wound vac certification because they don't know how to do it. You all, we are reusing water and we're reusing these stations. I just got to put water in this last basin. Yes, if you could read it for drainage bag and catheter care. Thank you.
intake. Mm-hmm. All right. So great job, everybody. Maybe a little bit hard for you to see if you're in the front. So if Nicole, this may be hard for you to see, but you don't have to necessarily stand up. So when we say that someone has a urinary catheter, the catheter is the flexible tubing that's attached to a drainage bag. This is not a CNA skill. You cannot insert because what type of gloves would this require? Sterile gloves. So once you're working in the hospital, they may call you a patient care tech. And as a patient care tech, you may be allowed to insert things. But as a CNA, the answer is no. The urinary system consists of the kidneys. The ureters are the tubes that once the blood has been filtered and it's filtered by the kidneys, is then stored, drains from the kidneys to the ureters into the bladder. So when someone has a indwelling catheter, they have to have a medical reason for it. What would be a medical reason that someone has a catheter inside of their bladder, which can increase their chances of infection? So after surgery, because they can't get up and do what? Walk. And then the sedation anesthesia them organs to sleep too. So while their organs are sleeping, we don't want them to retain all that urine. So that's why that would be a medical reason. If someone has a bed sore that keeps getting wet because they're the I word, what's the I word? Incontinent, that would be a medical reason because if they're wetting themselves, and some of your facilities will have a PureWick, which is like a wand that's attached to a suction. That's what they use for females. And for a man, they can use a condom catheter. I have a whole video on condom catheters. It's literally a condom that's attached to a bag. And they're still incontinent, but at least it's contained. What's this part called? It's called starts to see. Catheter. So as a CNA, you cannot insert it, but the part that's external, you are responsible for cleaning it. When I pass this around, you may have just come over and look in a few moments. This one is the port where the nurse inserts saline. This tip ends up ballooning out. So the way the catheter stays in place is that when the nurse inserts saline, this actually poofs out. And that's what's going to keep it secure in the base of the bladder. But when your patient's pulling on their catheters, they can literally, if they pull hard enough, pull it out with the balloon in place. And what are you immediately going to see? Blood. So it's not the most comfortable thing for them to have. But if you see them pulling on it, get your nurse in the room because we need to decide if the person really needs it or if they need to be restrained or if we can do something to keep them preoccupied, like get a sitter in the room. This blue port is for your specimen collection. So when someone has a catheter, we don't necessarily get a urine culture because this catheter can stay in place for up to 30 days. But what we can do instead is if they just need a urinalysis, let's say if you have sugar in your urine, not if you have a bug in your urine. You connect a syringe without a needle, pull back on the plunger, and if you have clamp this with a clamp or if you have you would take a rubber band, it's going to force urine to become trapped. And when you aspirate, you'd be able to pull out your specimen, transfer that into a urine cup. So this port is for what, everybody? Specimen. Do you insert a needle, a syringe with a needle? No. A regular syringe, no needle, it just twists on and you pull back. If you clamp this, you have to remember that you clamped it because this person is now going to have bladder pressure. How do you know if somebody's retaining urine? What might you see? Bloating, and we call that bladder distension or abdominal distension. Catheter, our specimen collection port, our clear tubing so we know what color the urine is in real time, and then our drainage bag. The drainage bag has a hook. Can you hook the drainage bag to the side rail? No, we don't hook anything to the side rail. Why? It can move, and so if you don't have this secure and you lower the side rail, you're pulling on their genitals. It's going to hurt. We call these urometers. Sometimes it's going to have like an extra container in the front, and so you're going to empty this bag when it is either half filled or at the end of your shift. I'm not going to mess with this too much, but this is your, I'm going to let this hit the ground, which is wrong. This is your, I want to say, I'm calling it a port for some reason. This is your spout. Don't hold this down at the test site until your nurse is going to say, hey, do you want to see the drainage bag? You're going to say yes. With the handle up, with the spout up, you just want to figure out how to open it and how to close it. If you practice with it and the spout's down, you're going to be wasting the urine. And they only put enough simulated urine in here for your test. What fails you during the urinary drainage bag skill, which you empty in the bag, is that you must document in CCs. You have to document in CCs. So if you just put 480 and you don't put anything behind it, are you going to pass? No, it would be 480 CCs. What else would fail you? You have to clean the spout with alcohol. Do you have to wear gloves during this skill? Yes. And whenever you're pouring out the simulated urine, we know this is just colored water, but if you pour it into the sink, are you going to pass your exam? No. So you have to pour it into the toilet. So we'll get to this next. I haven't shown you the skill yet. I got you. I got you. I'm just talking about the catheter.
Oh, yeah, I'm just asking, when bringing it,
Mhm.
you document it before by looking at.
We have to pour it into a container. I got you. I got you. Sorry, YouTube. You can't see all this. We'll cover this up for YouTube. So if you all can go to your documentation form, though, which I think is in on the second page of your very small packet. So this person now has a catheter. Let me give one more patient a catheter. Hey Tim, would you send a note telling everyone thank you for purchasing the book? We had a few orders today. And also thank our channel members on YouTube. Oh, this one's hard. Come on. You can do it. What other questions do you all have regarding catheters while I'm trying to catheterize this mannequin who is being very difficult? I still have it there. So once everybody's standing, I'll make sure I answer it for you. That's a very good question. Okay, so I got that one in there. All right, so for catheter care, we only have 2 mannequin stations, but this is an easy skill. What? All right, so this one will be there. All right, so everybody, you're welcome to gather around. We have a wonderful question that Miss Dolores asked. Oh, shoot. Okay. How to take care of a male who might become erect while you are giving them a bath? Very good question because it's going to happen. All right, so everybody give me a takeaway. Tell me something you learned today.
make sure that the patient is on their side and the sheet is tucked under them, and the clean sheet is not overlapping the dirty one.
Perfect.
So it's not dirty.
Now, if you did have to do that for some reason, what could you put as a barrier between the two? A towel, yes, because sometimes it's like this person's big, and I got to put all this stuff under them, and I'm not sure what I'm pushing beneath them. Dirty towel, clean. That way, your cleanliness would only touch the clean towel, not the dirty supplies. All right, your question. So you're giving a male a bath, and he becomes erect. Mentally, I'm applauding him because if Papa can get erect, I'm sorry. I am not that upset about it because they're going to respond based on how you respond. You're giving this man a bath. He becomes erect. You see his sheet standing up. What can you put over his lap? A towel. More than likely, they are not flirting with you. They're actually embarrassed because it has happened. And so, how you respond is going to determine how he responds. Now, if you act all giggly like a little schoolgirl, probably every time you give him a bath, it's going to happen again. So, what I would do instead is here's a washcloth. I'm going to wash the rest of your body. You can take care of your penis. I understand it happens. That's okay. Somebody who's just perverted and you feel uncomfortable and you feel like they're doing that intentionally, that's not going to be somebody you bathe alone, or it's going to be somebody you're extra stern with. The way you're looking at me right now is how you're going to look at him, and he's going to be less likely to become erect when he sees you. Worst case scenario, every time you come in, he's erect, you're giving him a bath, don't use warm water. Use cold water. Now he gonna report you, but is he gonna like you? No. Is he gonna get erect again? No. She's mean. She put cold water on me. Sir, I'm here to do a job, and every time I come in, you're erect, and I just need to focus on what I need to focus on. So you take care of them, I'm take care of everything else. Okay. Got it. If you're uncomfortable, should you be bathing them alone? No. Meanwhile, I'm applauding Papa. All right, woo, Papa, 88. Okay, so when I tell you that 99% of them are going to be apologetic because it's happening.
Well, yeah, I
Mhm.
understand because it's just a natural touch. It's a natural thing.
And then I've had more problems with females than with males. The younger females, the psych patients, those are the ones who are sometimes more inappropriate. Can I follow you online? What club do you go to? You want to hang out afterwards? So for me, that is more, yeah,
You see, I'm learning. No, I'm learning a lot.
yeah. So some of the females are more aggressive than the males.
Yeah, I got it. Okay,
And you're going to just stay stern with everybody.
got it.
Oh no, Miss Margaret, you're really nice to work with.
Cold water too.
All right, everybody, for catheter care, it's wash, wash, rinse, rinse, dry, dry. So I'm going to pretend that my fingers are the vaginal area and that this black part coming through is the catheter. Your patients will still be on their menses. What's menses? Their menstrual cycle with a catheter. During stress, sometimes the menstrual cycle comes on faster. So don't just think that only older people have catheters. All age ranges can have a catheter because we put it in before their surgery. So now her cycle's on and she has this catheter. There's blood on the catheter. So if you wash, rinse, and dry the vagina, what's still on the catheter? The blood. So it's wash, wash, rinse, rinse, dry, dry. What's the catheter care song? Sing it for Mr. Loris.
Wash,
Rinse, rinse, dry, dry. Awesome. So when I'm showing you the skill, if for some reason you can't get it right because it's like, oh, I don't understand it, I will put like lotion or something that you can see to simulate yeast. Because in the real world, if you can see it, you're going to make sure, oh, let me get all this off the patient. So it's going to be vagina first, side, side, center, hold a catheter, washcloth down 3 times, change positions down 3 times. Sometimes it gets sediment or like some crusty stuff on it because they've been draining down there. Last thing about catheter, is that some of them will be secured to the upper thigh. At the test site, the catheter will not be secured, but it must flow dependently, meaning that whenever you have it secured to a non-movable part of the bed, such as the bed frame, like this one would probably go beneath. It wouldn't be there. It'd be there. When you have it secured to a non-movable part of the bed, it should be going towards the foot, not towards the head. What's wrong with this picture? A lot, but what's wrong with it? Mainly, it's up, so
The urine can't.
it can't flow. And if there was urine still in the tube, in what direction would it go? It would go back down. And I'm sorry, would you? Oh, that one died on me. Would you turn this one back? Turn it this way. Sorry, TikTok. They're by TikTok. It was cool if you turn it towards this mannequin. All right, so let's get started. I will talk you through as you go. We only have 2 stations, so she was too hard to catheterize, so we have that station and that station. So perfect over here, Christian. I see your gloves on. Looks like your nurse is going to be Karen. Come on over, Karen. All right, go ahead and put a towel over her lap. So for YouTube, we don't get in trouble. So it's similar to last time. And so right now it's 3 people per station, but one is just looking. Okay, awesome. Oh, you don't have soap? Here you go. Oh, that's Germex. That's not soap. That's also Germex. It's behind you. Mhm. All right, you can go ahead and pull your covers back. You can put your towel on. All right, have your nurse check your water temperature when you're done. Oh, go ahead. Don't try to go as fast as I'm saying it because you don't have her exposed yet. Go ahead and get her exposed. I know, but you're not on camera right now. You don't have to be perfect. Mhm. I know it's cold. Sorry about that. And then towel. Did you charge it up for me?
Yeah.
Okay, thank you. Girl, put that towel down. Come on now. All right, raise that gown. Part those legs a little bit. And again, for those who are just watching, you're welcome to have a seat. I know it's been a long work day. Awesome. Wet the your nurse. I saw your nurse check your temperature. Did your nurse check your temperature? All right, wet your washcloth, wring it, and then apply 1 drop of soap. If the water gets soapy, it's nothing you did. It's because we're reusing the washcloths for training purposes. Dry those hands because you don't want to get. For this skill, we put a pad beneath them just for this part of the skill. You'd have to take the pad out at the end. So the last person who goes has to remove the pad. Dry your hands, Christian. They're still dripping. All right, so outer, and then lift the catheter, go down the center. Outer, lift the catheter, towel from under, go under. So this is what I do for her. I cover up her legs. Her legs are, she's going to be cold. There you go. So you still have a job to do. So it's like you're trying to keep them warm, but you got to work. Okay, so outer, then switch places on the washcloth. Don't touch twice. Good. Change spots. Did you change? So you have to wipe that second one again. I didn't. Did she change spots? I didn't see it.
So I wipe each wipe it and then flip it.
And then flip it. Change. Good. I'm coming over there now. Outer, and then you can wipe above the clitoral area. Okay. And then raise the catheter. They won't fail you for that one. Let me see how you clean beneath the catheter. So let's see. So clean above first, the clitoral area. Above the catheter first. And now raise the catheter gently. Clean the vagina beneath the catheter. Awesome. Outer center. What's the catheter song? Wash. So now we're going to get a new washcloth Wet it, wring it, apply how much soap? 1 drop of soap. Make sure those hands are dry, even though you're moving this pad afterwards. It's just a good practice. Yes, ma'am.
Only wipe the vagina without actually doing the catheter itself.
Because it's vagina first, catheter second.
Okay, so you would use a different washcloth.
Because the first one still has her menstrual cycle on it, has blood on it. So you got to think that these washcloths are contaminated. So that's why you have so many of them. All right, so hold up. When your finger should be towards the labia. The labia are like the lips of the vagina. Yes. Like you're opening a little. So all the way here at the insertion point. Because that's going to prevent you from tugging on it. Wrap your washcloth around and then gently slide down. So let me get your hands right. Because you're tugging the catheter. So these 2 fingers here. This washcloth wraps around. Make sure you're not tugging on the catheter. Wrap it around. Slide down. Change spots. Repeat that process a total of 3 times. Check on your residents. See if they're okay. What did she say? She's not talking to ma'am. I'm tired. Okay, you're doing too much. Why don't you just let the catheter go and use 2 hands instead of you flinging a washcloth around? That's been in someone's private area. There you go, young lady. Wash, wash. What's the next part of the song? Rinse, rinse. Go ahead and get a washcloth. And now for this one, you can use the same washcloth twice. But if not, you have an additional one there just in case. When you wash everything, when you wash the catheter, you wash it 3 times. When you rinse it, you don't have to rinse it once.
For everything.
You can use that washcloth for everything. I just like you just keep changing location, changing spots. I see that washcloth over there just dripping, dripping, dripping. Dry your hands. Good. Great job. Tell your resident what you're about to do. I'm going to rinse you. Good. Down and then change. Get that soap off of her because I'm tired of seeing it. It's on her. It's right there on that label. Looks like that's soap, or maybe it's a spot right there. Okay, my bad. Down, change. Yes, ma'am.
A different one.
When in doubt, use a different washcloth. When in doubt, use a different washcloth because I don't want you overthinking it. When in doubt, use a different washcloth because you can always do more. You just can't do less. At the test site, there won't be any menstrual blood or anything, but in the real world, you go in with more than 4 washcloths. You're giving someone a bath, you get you a stack of everything that you need. You can, and you only have to rinse it once. Just make sure you rinse it in the right direction. Well, then go ahead and can we keep it charged?
Do this have to be in it? I can plug this. Wires up there. They can reach it.
Oh, my phone died.
What you got there?
It's asking for enter a PUK code to continue. You have 10 remaining. I'm not sure what happened to my phone. I don't know what a PUK code is. I have no idea. That phone died, and now I don't know what a PUK code is. I have to call Verizon. I've never heard that before. Okay, we did well. Good. All right. So for classroom purposes, we're gonna fold everything back up so the next person can go.
Then they see that.
Can we totally like cut the phone off? It won't cut off again.
You cut it off.
Yeah, thank you. And for this one, you also we save a little bit of time because it's 12:34. You don't have to pull the sheets up and all that other stuff because you all, because you all know how to pull the sheet up. I see you starting off wrong. Hands lower than your elbows. There you go. Off. Good. What do you say? Correction. Yes, ma'am. You can start. Present your water to your nurse.
Whatever you gotta do.
Okay, Coach Speed. I'm not sure what happened with my sim.
This need to be plugged in.
No, I've never had this issue before with my phone. I'm not sure what happened. I have to look up what a PUK code is, but I'll charge it up there.
All right.
Just flip it. So your pills are up top. That's what she's saying. There you go. So here, pills are up top. There you go. So your corners, yeah. Y'all doing okay over there? Okay. Yeah, we're gonna get this right. I'm gonna tell her, like, your babies came back. Then lift up the catheter gently, and it's fine. You can always do more. You doing okay over there, Nicole?